Hi everyone, I'm Kadija Umaiya and today I will share with you about postpartum depression. Before we go any further, let me bring you what postpartum depression is. The term postpartum or postnatal refers to the period immediately following childbirth. Within a few days of giving birth, most mothers experience baby blues or a sense of sadness or emptiness. The newborn blues usually pass in 3 to 5 days for most mothers. If the baby blues do not go away or if they feel gloomy, hopeless or empty for more than 2 weeks, they may be suffering from postpartum depression. Feeling gloomy or empty after childbirth is not a normal or typical aspect of motherhood. Research showed that in Malaysia, Malay women were more likely to describe the symptoms of postpartum depression based on a combination of emotional and behavioral changes, whereas Chinese and Indian women talk more about emotional changes. Signs and symptoms of baby blues may include feeling restless or moody, feeling sad, hopeless or overwhelmed, crying a lot, having thoughts of hurting the baby or hurting yourself, not having any interest in the baby, not feeling connected to the baby, or feeling as if your baby is someone else's baby, having no energy or motivation, feeling worthless, guilty, or like a bad mother, and the list goes on and on. Although there is no single cause of postpartum depression, physical and emotional factors may play a role. Firstly, in terms of physical changes, a large decline in hormones which are estrogen and progesterone in the mother's body after childbirth may lead to postpartum depression. Other hormones generated by the thyroid gland may also fall sharply, leaving the mothers feel exhausted, lazy, and sad. Meanwhile, mothers who are having postpartum depression may be caused by emotional issues. When the mothers are sleep deprived and overwhelmed, they may struggle to deal with even simple issues. They could be concerned about their abilities to care for a newborn. They may feel less beautiful, unsure of their identity, or as if they have lost control of their life. Postpartum depression can be caused by any of these factors. So, how is postpartum depression treated? The common types of treatment for postpartum depression are: first, therapy. You talk to a therapist, psychologist, or social worker during therapy to discover techniques to change how depression makes you think, feel, and act. Medicine. There are various medications available to treat postpartum depression. They must all be prescribed by your doctor or nurse. Antidepressants are the most prevalent category. It helps ease depressive symptoms and some can be taken during breastfeeding. People suffering from depression may be unaware of the fact that they are depressed. They may be ignorant to the signs and symptoms of depression. If you feel a friend or loved one is suffering from postpartum depression or is developing postpartum psychosis, assist them in seeking quick medical assistance. Don't sit around and hope for the best.